For differential diagnosis and palpatory findings, heel pain syndrome would be painful at the medial calcaneal tuberosity, here. With heel pain syndrome, there are two motions that would decrease the symptoms to rule in the diagnosis. So at relaxed palpation, pain here, extend the toes and palpate, the pain will resolve or significantly reduce. This is due to the fact that the plantar fascia has become taut and bowstringed, and subsequently you're not able to palpate into the intrinsic musculature, which is the primary tissue of concern. Similarly, when you find pain at the medial calcaneal tuberosity, you will also find that a reduction into a dorsal direction of the cuboid will resolve all palpatory symptoms.